Hi, my name is Jada Santi, and this is my pediatric infant health assessment video for Pediatric Primary Care, Albany State University. Today, I am going to have Jamila playing the mother, and Timothy is her young infant. Hi, Jamila.
Hello.
My name is Jade. I'm a nurse practitioner here at the facility. I'm going to be assessing Timothy and just doing a well child check on him, okay?
Sounds good.
So before we start, let me just talk to you a little bit about Timothy. How's it going? Are you a new mom?
No.
Oh, you have other children?
Yes.
Okay. Do you have any concerns about Timothy?
Nope.
Okay. How are his eating habits?
He eats like 4 times a day.
Okay. About, would you say like maybe 5-6 ounces or?
Yeah.
Good. Are you noticing any problems with eating, reflux?
No.
Gas?
No.
Okay.
Takes the whole bottle.
Wonderful. And is he having like regular bowel movements and urinating?
Very large, but
Good.
he's doing good.
Okay, so it seems like he doesn't have any concerns. How's sleeping going?
He sleeps through the night most of the night.
Really?
Yeah.
Wonderful. Okay, and he's about 4 months now?
Mm-hmm.
Okay, great.
Yeah.
All right, so let's get to, I'll let you kind of keep him in your arms.
All right.
I'm going to start by, I do a general assessment of Timothy. He seems quiet. What I'm first doing is I want to start cephalocaudal, so I'm going to look at his head. When I look at his head, his anterior fontanelle is still flat and soft. His posterior fontanelle feels closed. As I'm looking at his scalp, I do not see any cephalahematomas, okay? Next, I'm going to move down to his eyes. And one thing that is important to look at is eyes to ears, and just to make sure that the crease of his eyes match the length to his ear, because then if it was lower, it would indicate low set ears, and that could be a congenital anomaly or some kind of defect. But his ears look fine. I'm going to go ahead and just look into his eyes. Okay, good. And then I'm going to check his nasal patency. Has he had any like sniffles or cold? No. Just very healthy. Okay, I'm going to put on gloves. And what I'm doing is I'm going to take my finger and insert in his mouth and just check for a suck reflex, which he has a good one. And then I'm going to look in his mouth, and I do not see a cleft lip. And then I do not see a cleft palate. Okay, and then in assessing Timothy, I notice his neck width is normal. It's not webbed, so that could also indicate another congenital anomaly, but it's not. My next order of business is just to look at his chest. I don't see any pectus where the chest would cave out. It's pretty flat. It looks symmetrical. I'm going to go ahead and I'm going to take a listen to Timothy. On birth, did they say anything about any heart defects? Just looking at his record, I didn't see any. They did say he had a small murmur, but for babies his age, that's normal. Okay. And once the PDA completely closes, then that murmur should go away. Good. But in a couple months, when we reevaluate him, if he still has a murmur, then we're gonna need cardiology, just to look at it. Okay. All right, so I'm gonna go ahead and auscultate. So with peds, you're gonna go ahead and use the bell of your stethoscope. Okay, so doing lungs. Timothy has a small residual murmur, which again, once the PDA closes, he should not have. Okay, then I'm going to go ahead and auscultate bowel sounds, and with babies, we generally do it right here. Bowel sounds are present. Okay, and then I'm going to go ahead and just palpate little stomach. Okay, so he's very quiet. Next, Mom, what I'm going to do is I'm going to go ahead and take off the onesie. Okay. Looking also at his skin, which looks pretty good, pink pale, normal for ethnicity. I'm gonna go ahead and open Timothy's diaper. And what I first wanna do is I'm gonna check his pulses. So I'm checking his femoral pulses, which are 2+. And then my next thing is I'm looking at his genitalia. Everything looks normal. No evidence of hydrocele. Okay, and you said like he urinates fine, no issues?
Right.
All right, good. Okay, then because he's still young, I could check for hip dysplasia. I could do the either the Ortolani test, and what I would do is either I would abduct his legs, or I would put him in a 90-degree angle and then I would push out. But hip dysplasia was negative in his first exam. I don't see any evidence or indication to do it, so I'm going to continue my assessment. Checking his lower extremities, his color is still nice and even, warm, pulses. He seems very well perfused. Let's check his cap refill on his toes, which, because he's so little, you can either pinch the toe or you can just press the bottom of his heels for cap refill. Okay. When I was palpating and feeling his pulses, I didn't feel any like inguinal hernias, and also just looking at his belly button, I didn't see any umbilical hernias, so that's really good. My next thing is I'm just gonna have you hold him so I can check his back.
Okay.
So let me fasten the diaper, I'm sorry. Okay, so I'm just gonna have you hold him. All right, so I'm just checking his back. Sometimes babies get like either like Mongolian spots or some type of rashes on their back, which is totally normal, and I don't see any. I'm gonna look at his buttocks. I don't see any. Okay. All right, thank you so much. He seems very healthy, and at this time, do you have any concerns?
No, I don't.
Okay, well, that's my assessment of an infant.